Disclaimer. This podcast is for educational purposes only and should not be considered medical advice. Always consult with a qualified healthcare provider before starting or changing any health, fitness, or supplement program. Today we are going to explore IGF-1, also known as insulin-like growth factor 1, a peptide that has captured the attention of researchers, athletes, and those interested in performance optimization and anti-aging. IGF-1 is naturally produced in the body, primarily in the liver, and is stimulated by growth hormone. Once released, it plays a central role in cell growth, repair, and regeneration. It is often described as a mediator of growth hormone because it translates many of the anabolic effects of growth hormone into action at the cellular level. To understand IGF-1, imagine it as a messenger. Growth hormone tells the liver to produce IGF-1, and then IGF-1 travels through the body, telling muscles, bones, and tissues to grow, repair, and adapt. It is crucial during childhood and adolescence for physical development, but its influence does not stop when we become adults. Even in later life, IGF-1 contributes to maintaining lean muscle mass, bone strength, tissue healing, and metabolic health. Researchers have found that IGF-1 has powerful effects on muscle hypertrophy. When levels are sufficient, muscle fibers experience greater protein synthesis, leading to more growth after training. Athletes and bodybuilders became interested in IGF-1 because it supports recovery from intense exercise and can help reduce the breakdown of muscle tissue. This means improved strength, faster adaptation to training, and possibly greater athletic performance. Beyond muscles, IGF-1 is also linked to neurological health. It supports brain function by promoting neurogenesis, which is the creation of new neurons, and synaptic plasticity, which is the ability of brain cells to form new connections. Animal studies have suggested that IGF-1 may enhance memory, learning, and even mood. In humans, there is evidence that higher IGF-1 levels correlate with reduced risk of neurodegenerative conditions and better cognitive resilience. IGF-1 is also involved in wound healing and tissue repair. Because it encourages cell proliferation, new blood vessel formation, and collagen synthesis, it may speed recovery from injuries such as tendon tears, ligament damage, and bone fractures. This has led to therapeutic exploration of IGF-1 or IGF-1 analogs in regenerative medicine. Now, like most peptides, IGF-1 is not without controversy. On one side, some scientists see promise for age-related decline, muscle wasting conditions, or recovery from illness and injury. On the other side, there are concerns about overstimulation. Since IGF-1 drives cell growth, there is a theoretical risk of supporting unwanted cell growth, such as cancer. This is why the peptide is studied cautiously, and why medical supervision is emphasized if someone is considering therapies that influence IGF-1. From a longevity standpoint, IGF-1 presents a paradox. Higher levels are associated with better muscle, bone, and cognitive health. Yet extremely high levels may shorten lifespan in animal studies. Conversely, very low levels are associated with frailty, weakness, and poor healing. Researchers often conclude that balance is the key. Too much may accelerate aging in some tissues, too little may lead to decline, and somewhere in the middle seems to promote resilience and healthy aging. In practical use, IGF-1 peptides are available in synthetic forms, often called IGF-1 LR3 or IGF-1 DES. These versions are designed to have slightly different activity profiles. IGF-1-LR3, for example, has a longer half-life, meaning it remains active in the body for longer. IGF-1-DES has a shorter action but may be more potent at the site of injection, often near a muscle being trained. People interested in muscle growth sometimes use localized injections in hopes of increasing muscle response where it is most desired. However, clinical evidence for bodybuilders' practices is limited, and most of the reliable information about IGF-1 comes from controlled studies in medicine, not from gym experiments. It is important to highlight this distinction. While anecdotal reports claim faster growth, less soreness, and better recovery, science still has much to uncover about how effective and safe these uses are. Another fascinating area of research is IGF-1 and cardiovascular health. IGF-1 appears to protect blood vessels, improve insulin sensitivity, and reduce markers of inflammation. Lower levels of IGF-1 have been linked to higher cardiovascular risk. On the other hand, excess IGF-1 might encourage smooth muscle cell growth in arteries, which could lead to thickening of vessel walls. Once again, balance seems to be everything. When it comes to dosing, protocols vary dramatically depending on the goal. In research, small microgram doses are typically used. Athletes in underground communities sometimes discuss using higher ranges, but this is where risks become more significant. Side effects may include joint pain, swelling, hypoglycemia, or cellular overgrowth in unwanted tissues. Because IGF-1 interacts with insulin pathways, blood sugar levels can also be influenced, which may be dangerous without proper monitoring. Let's also not forget that IGF-1 interacts with many hormones. It does not act in isolation. Its effects are tied closely with growth hormone, insulin, testosterone, and even thyroid function. This makes it complex to manage and difficult to predict outcomes without a full picture of someone's endocrine health. Some researchers are investigating whether IGF-1 therapy can help patients with conditions like muscle wasting due to HIV, cancer, or age-related sarcopenia. In these contexts, restoring function and quality of life is the goal, and the benefits may outweigh the risks. Clinical supervision ensures dosing is controlled and patients are monitored. For the average person interested in IGF-1, lifestyle plays a big role in natural levels. Exercise, particularly resistance training, can increase IGF-1. Adequate protein intake, good sleep, and balanced nutrition also support healthy levels. Caloric restriction may lower IGF-1, which some longevity researchers believe may contribute to lifespan extension. Yet too little IGF-1 can also mean frailty. Again, the balance question surfaces. If you zoom out, IGF-1 represents one of the body's most fascinating balancing acts. It fuels growth and healing, sharpens a brain, protects the heart, and maintains muscle and bone. But like fire, too much can burn, too little can leave you cold. Learning how to work with this peptide responsibly is the challenge scientists and health professionals continue to study. Another dimension to consider is delivery methods. While injections are the most direct way, researchers have looked at nasal sprays and oral forms, though their bioavailability is lower. The body's digestive system usually breaks down peptides, making oral forms unreliable. This is why injections remain the standard in both research and underground use. Because IGF-1 is a growth factor, Anti-doping agencies classify it as a banned substance for athletes. Its potential to unfairly boost recovery, performance, and muscle growth means it is not allowed in professional sports. This highlights again that while it may seem attractive, misuse can carry ethical and legal consequences. To wrap things up, IGF-1 peptides stand at the crossroads of growth, repair, performance, and aging. They show promise for healing and protecting the body, but they also raise important questions about safety, balance, and long-term effects. The future of IGF-1 research will likely focus on how to harness its benefits for healing and neuroprotection while minimizing the risks of overstimulation. Disclaimer: this podcast is for educational purposes only and should not be considered medical advice. Always consult with a qualified healthcare provider before starting or changing any health, fitness, or supplement program. Thanks for listening. Keep learning and stay curious.